can be employed right within this platform to build your confidence, to take care of your mental health, and to even alert you that something is amiss?
Yeah, social media is a very good source of access to resources. So if, let's say, for example, you go to where I work, Chiramo Hospital Group, our website is a very good website to start from, where you can get resources to help you do self-assessments. You can get a resource to contact yourself to a psychologist if you need help. You can get national hotlines for if you're not feeling well and you need to talk to someone. You can get support from social media a lot. We also can use it as a support, because we have seen that we are able to use social media to create support groups. So people, men who are struggling with depression, can come together, and because we are now digitizing, you are able to have, let's say, meeting amongst men at 9 p.m. or 7 p.m. and discuss these issues amongst yourself. Social media is also a very good outlet of expressing your creativity, and art and all those things have been shown to help people express their emotions and also emphasize on their mental wellness. What I might also need to talk about is mindful use of media and social media. So limit screen time. Okay. You know, screen time might affect how your mental wellness is. Also, if you are able to pick up any toxic content, just unfollow, and know that ignore whatever is not going to be helpful to your physical and mental health. Also, focus on authenticity. As you have said, do you need to show that...
But for each their own. What might be authentic to me might not be authentic to you.
Yeah, you argue that.
Yeah.
But authenticity means what is going to help you in the long run.
Right.
Are you having a happy life? Do you need a top-range car to be happy, or do you just need to help someone in the society? Right. So that is a thin line to cross, yes, but the more authentic you are to yourself and to your personality, the more healthy you are physically and mentally. Also, you should be mindful of the content you put out as well, because if it's hateful content, it might propagate hate, and hate in itself is not a good predictor of mental health.
Yeah. Dr. we've had a very good conversation, and I'd like us to close with you helping us unpack the narrative that being strong as a man means being silent and remaining silent. A lot of men watching this show have chosen to remain silent over the years because of what we began by saying, that it is expected of them.
Yeah. I'll close by saying being strong is a good thing. I wish I had muscles. But anyway, if you have physical and mental strength, you are able to understand that you have weaknesses as well as a human being. You are not God in any way. So there are days that you will be low, there are days that will be high for you, and once you recognize that it's causing any effect to your life, be it physical, be it mental, feel free to reach out to us. It is not any sort of weakness. If you had a physical fracture, it wouldn't be weakness to go to hospital. So if you feel like you are a bit low, or you are a bit anxious, or your productivity at work is not well, or you are having a headache, just step in and go and watch and see a doctor and say, hey doc, this is not good for me.
Yeah. Somebody has written to me and said that as a man, I agree that after seeking help, there is strength in vulnerability. Let's close with that statement. Yeah, what do you make of that? Yeah,
there is strength in vulnerability. Every day we see patients who come very involuntarily and say, I don't think I need your help. But once they start getting help, they ask me, Dr. why didn't I come earlier? And they start wondering. And these are now the champions, because they go out there and tell other men that it is not bad to go and seek help. And vulnerability is what is going to show a form of strength. Yeah.
And finally, people would argue that this is a preserve of the middle class, perhaps the wealthy. Somebody perhaps watching us, from the rural areas, wondering and really flowing this conversation and wondering where they can get help, whether the government has equipped public facilities, public hospitals with, the know-how, the staff, the skilled staff that would be rightly placed in terms of handling a situation like this, perhaps in far-flung areas where our viewers are watching from.
Yeah, the government has tried. It's played a very big role in helping, first and foremost, equip hospitals as much as they could. If you were to see like 10 years ago compared to today, there are more psychiatrists in Kenya. There are more county hospitals and sub-county hospitals actually with psychiatrist help. There is more resource mobilization towards mental health from the government itself, as I've told you earlier, with the resources using them to help us understand and demystify, prevent and promote mental health. So the government is playing its part. Us in the private sector are also playing our part. And yes, we are here to help, and I think we are on the right trajectory as Kenya compared to maybe our neighbors or the rest of the world.
Yeah. And we've been talking to Dr. Joseph Nyamiobo, a corporate psychiatrist, Chiromo Hospital Group. June being Men's Mental Health Awareness Month, Daktari advises that there is strength in vulnerability. So seek help if you identify any of the triggers that we've talked about this morning. My name is Lillian Muli. It's been a pleasure as always. Have a great day.
Thank you.